Hi friend, my name is Mayur Deshmukh. I am from KT Patil College of B Pharmacy 3rd year. Today in this video I will discuss about the antirheumatoid drug. Let's start with the index of the chapter. First is the introduction, second is the rheumatoid arthritis, third one is the antirheumatoid drug, fourth is the classification of drug, and last one is the role of the drugs. First of all, discuss about the basic part, that what is rheumatoid arthritis. Rheumatoid arthritis, it is an autoimmune disease. It causes the destruction of joint. It produces PGS responsible for the analgesia inflammation. It is characterized by joint inflammation and destruction of articular cartilage. Next is the anti-rheumatoid drug. These are the drugs which can suppress the rheumatoid process, bring about a remission and retard disease progression, but do not have non-specific anti-inflammatory or analgesic action. They are used in rheumatoid arthritis drug, DMARDs, or slow-acting anti-rheumatoid drug. The honest benefit with the DMARDs takes a few months of regular treatment and replace the Acubra few months after cessation of therapy. Recently, some biological agents have been added for resistant cases. Now let's see the classification of anti-rheumatoid drug. First main class is disease-modifying anti-rheumatic drug, in which subclass is non-biological drug, in which immune suppressant, for the example methotrexate. Second subclass is biological agent, in which TNF alpha inhibitor, for the example etanercept. Second is the IL-1 antagonist, for the example Ankinara. Second main class is adjuvant drug, in which corticosteroids, for the example of prednisolone and other. Let's start to see its one by one class of the drug. First is DMARDs. These are the agents that modify the progression of disease. These are also known as slow-acting anti-rheumatoid drug. In this subclass is non-biological drug. These are the small molecules drug. These are also known as conventional synthetic DMARDs. These are classified in immunosuppression, for the example methotrexate. Methotrexate dihydrofluoride reductase inhibitor has prominent immunosuppressant and inflammatory property. Act by inhibiting dihydrofluoride reductase, leading to inhibition of cytokine production. Second drug is sulfasalazine. It is a compound of sulfapyridine and 5-amino salicylic acid. Exert anti-inflammatory activity. It deep bowel and in useful to ulcerative colitis. And it suppresses the disease in significant number big rheumatoid arthritis patient. Mechanism: it split off in colon by bacterial action and get absorbed by inflammatory cell function and suppressed. Uses: used with the methotrexate, it rheumatoid arthritis used as second life drug, used in secondary bowel disease. Adverse effect: neutropenia, hepatitis. Next drug is a chloroquine and hydroxychloroquine. These are anti-malaria drugs found to induce the remission in up to 50% patients of rheumatoid arthritis, but take 3 to 6 months. Their advantages is relative low toxicity, but efficacy is also low, and bone erosion are prevented. Uses: rheumatoid arthritis, these drugs have to be given for long period, used in milder non-erosive disease, used in malaria, etc. Adverse effect: retinal damage, coronary opacity. Last drug of non-biological class is leflunomide. This immunomodulator inhibits the proliferation of stimulated lymphocytes in patients with the activity of rheumatoid arthritis. Leflunomide is rapidly converted in the body to an active metabolism which inhibits the dehydrogenation pyrimidine synthetic inactivity, divides cells. Adverse effect: thrombocytopenia, leukopenia, headache, diarrhea, not used in children, and also pregnant women. Another subclass is biological agent. These are recombinant protein or monoclonal antibodies derived from living organisms, hence it called as biological agent. These are classified into two classes: TNF alpha inhibitor and other biologicals. In this first is the TNF alpha inhibitor. TNF alpha play important role in inflammatory rheumatoid arthritis by activating membrane bound receptor bond the form of T cells macrophage. Example is etanercept. Following diagram shows the example of TNH alpha inhibitor. First example is interocept. It is a recombinant fusion protein of TNF receptor and Fc protein of human, administered by 15 mg weekly at 2 at injection site. Pain, itching, redness, swelling is occurs, and chest infection may be increased but immunologists in not clinical problem. Next class is IL-1 antagonist. In the example anakinra, it is a recombinant human IL-1 receptor antagonist, clinically less effective than TNF inhibitor. It has been used in cases who have failed one or more DMARDs. Dose 100 mg daily. Local reaction and chest infection are the main adverse effect of the drug. Next is a corticosteroid drug. It is the class of adjuvant drugs. First, it has a potent and anti-inflammatory activity. It can be inducted almost at any stage in rheumatoid arthritis along with first or second line drug. It potent anti-inflammatory action required. High dose for support of period. They are also used in intra-articular injection. Example is peridinoserine. These all are the class of drug which are used in the treatment of rheumatoid arthritis. I hope you understand that. Now we will stop here. Thank you.